Hi, welcome to the Fit and Healthy Today show. And as always, whatever subject material comes in front of me the days before the show is usually what I do a lecture on. And what was seeming to come in front of me, including my own son Augie, was, hey, what do we do for scars to prevent them and to treat them once we have them? And even if they're older scars, what can we do to maybe reduce the actual appearance of the scars? Now, when you're talking about prevention, good nutrition is very, very important. You know, a lot of good fruits and vegetables. You have to have adequate amounts of protein for the skin tissue to heal. In addition, adequate amounts of good fats to help keep the moisturization, and drinking lots of water. Those are all paramount before, just in everyday life to prevent scarring. But because our foods today lack certain types of nutrients, when we do get injured or we have surgeries, oftentimes we do not have the adequate amounts of nutrients for the skin tissues to repair, and we will scar. Now, scarring can be white lines, dark lines, jagged lines, or scarring oftentimes occurs when, because of lack of nutrients, if you get the inability of the skin tissues to actually mend itself internally, that will occur and you'll get those malappearances of the skin. Burns also lend themselves to scarring as well, too, particularly second and third degree burns. So if we don't have adequate amounts of treatment following the burn and adequate nutrition following and during and after the injury, then we'll scar. So prevention on a daily basis, everybody should always consider, and this is scarring, vascular health, all of the collagen matrix within the body, including the joints, tendons, and ligaments. You always have to have a good multiple vitamin that has a lot of B vitamins. And I'm not talking about a grocery store or a warehouse or a drugstore. I mean a good old USA-made multivitamin. Very, very important with chelated minerals. Adequate amounts of C. Now, you've probably heard me mention before that 75 years ago they guessed or averaged that an orange or a tomato would have had 500 milligrams of C. Now we're lucky if we have 25 milligrams. So, whenever you know that you tend to have a prevalence for scarring, I usually like at least 1,000 milligrams of a buffered or an esterified C, a fat-soluble C, of at least 1,000 milligrams at lunch and dinner. We like to keep the B's and C's apart because the C's can somewhat cancel out the B's. Adequate amounts of minerals. Heavy soda drinkers or alcohol drinkers or caffeine drinkers don't have adequate amounts of calcium, magnesium, and potassium that we derive from vegetables. So oftentimes then they don't have the right minerals for the skin tissues to repair. So keeping adequate amounts of calcium, magnesium, and potassium levels is pretty vital for skin tissue repair. Vitamin D. Over 90% of Americans are vitamin D deficient now because we're indoors, we play indoors, we work indoors, we do everything indoors. So we don't have adequate amounts of vitamin D for skin tissue repair and will scar. There's also, if you have a prevalence for scarring, MSM, there's an herb called Glucola. There's other herbal types of things that can help for prevention of scarring, but Glucola has clinical studies on it for inducing collagen matrix, and we use that for skin as well as bones, when you break bones, tendon, ligaments. Now, when we're looking, in addition to the supplements, there are some things that can be done, particularly if you know you could have potential scarring or immediately following an accident or a surgery. If you know you're going to have some type of, eye surgery, removing of a tumor, skin cancer on the face, I always suggest an Arnica montana, 30 C's, 3 times a day, at least 4 pellets under the tongue, 2 days before the surgery at least, and then at least 5 to 10 days after surgery. That really reduces the inflammation and some of the swelling and all that is associated. Because we need a lot of swelling and inflammation, you'll have a much greater prevalence of scarring as well too. Organic aloe vera gel immediately following the wound or the injury. If you can apply some organic aloe vera gel, The aloe vera literally to burns or to actual cuts stimulates the cell regulation and regeneration and reduces quite a bit of the inflammation response. I've seen this over and over again with burns, but aloe is phenomenal post-surgical wounds as well, particularly if we combine it with something called wound honey, also known as manuka honey. And there's UCLA studies on manuka with burns, post-burn or burn victims, for healing and inducing. It speeds the healing, but it also prevents any potential for infection. I love that combination of aloe with the honey. And then if you're even concerned about infection more, there's a wonderful ointment produced by the Nutrabiotic company that's a grapefruit seed extract, has an A, C, and E, and it's an antimicrobial. I've even seen it kill MRSA infections on the skin. So this is a great way to prevent infection and speed up the healing, topical in addition to the nutrients that I've mentioned here. Post-surgical as well too, very, very helpful for healing or prevention of scarring as well too. Works very, very well. Now, once the wound is healed, we've got the aloe vera, the manuka honey, the Nutrabiotic ointment, we get it near healed, and we still notice that we got a little bit of scarring, we had a jagged cut, we didn't have the best stitches, the doctor wasn't a great sewer. Then there are other things that we can do right following when a wound is not very old. Rubbing in and taking 5 to 10 minutes, rubbing in cocoa butter or coconut oil. Really, really can soften up that scarring and some of that raised appearance. Olive oil and vitamin E. Now, I know a lot of plastic surgeons will use the vitamin E oil, but the vitamin E with the 30,000 IUs mixed in with a little bit of natural cold-pressed olive oil, massage it in for at least 5 minutes, really, really can prevent and literally eat away at the scar or some of the raised areas that you may get with the stitches. That combination really does a good job. There's some good clinicals on coconut oil, and in coconut oil, if you notice on my information here, it can even help with old scars. It's rich in fatty acids and medium chain triglyceride fats. It seems to be able to fade away some of the old scarring that we get, literally. Cocoa butter also, even if the scar is old, can reduce the appearance of the scarring as well too. And once again, mind you, you put it on there and you sit there and you just massage it in and you grab more and you massage it in because you're literally trying to soften up the scar tissue. Now remember, with that massaging, you're getting really good circulation in the area as well too, getting the adequate amount of oxygenation. So including the nutrients that I mentioned earlier, orally, getting that circulation going into the scarring, trying to break up that scar tissue is very, very good. We use that a lot, that principle in physical therapy. When we're trying to loosen up scar tissue, we'll get that going as well. Now, there is also some good studies on onion extract, and I know that seems a bit odd, but I know there are some brand names out there, but there's some good, and it takes about 8 weeks to 6 months old, or 6 months in order for it to really loosen up. And this is really difficult old scars. It works better if the scars are under 3 months old, and we can, initially if you see those raised edges, you're not getting enough help with the olive oil or the cocoa butter or the coconut oil, then we can go on to the next step, which is the onion extracts. It really can help reduce the fine, the fine line or the very raised types of ones we'll see sometimes with surgical. Now, if you got good old barbed wire cuts, which I've seen on people when they're motorcycle riding or they get dumped by their horse or whatever, that also can help with some of that jagged edge healing. It's very difficult when you get horizontal cuts versus vertical cuts. You get a lot more scarring with those horizontal cutting as well, so you have to take more precautions regarding those types of cuts or wounds. Topical application of green tea and internal, believe it or not, the green tea, you can mix that in, with some of these other oils I've mentioned, help stimulate cellular regeneration and growth. Now, if it's a dark type of scar, lemon juice. You know, I've heard people use these for age spots, better things, but lemon juice, you know, you put a little bit on there and you rub it in and just let it sit there for about 10, 15 minutes and then wash it out. Can actually lighten the appearance, but you got to do it a good 3 times a day to get it to help. Now, exfoliating the skin, particularly we see with acne scars, and we can do this with baking soda paste. We can take a sugar scrub. There are actual formulas that have very small, fine pumice in them that can exfoliate the skin, stimulating, getting rid of those dead tissues as well. Particularly with acne scars, can be very, very helpful to get the skin to shed its lining and regenerate new skin, as long as you're using things that stimulate new skin cell growth internally and externally. Now, keloid healing. These are oftentimes people who are extremely nutritionally deficient. We've got a really bad scar, a really bad infection that's set in, staph infections that are prevalent in hospitals after surgeries oftentimes will keloid heal. We've got to try and see if we can catch those as early as we can with some of the suggestions I have up here. But there are other things that we've had some good success with. Cucumber paste. You know, now we use cucumbers under the eye to sometimes get rid of the dark circles, but a paste made with cucumbers, and you can take the cucumber, mix it up like in a food processor, and put it on the area, even combined with a little bit of coconut oil, actually can be very helpful. The cucumber paste actually you can apply before bedtime, just the cucumber itself, and you can even wrap it in a little bit of gauze, and it can be very helpful for keloid healing as well. Now, I found some good clinicals on rose hip seed oil, and you know, we don't use that very much in the natural industry, but rose hip seed oil, massage it in 2 or 3 times a day. Very helpful for deep scarring, acne scars, scars that have been there a long time. Once again, we still want to exfoliate, moving the skin tissue along, nutrients, massaging, getting good circulation. You know, other than surgical intervention, there's really not much we can do other than these types of natural things to try to stimulate the body to repair itself. You know, I had a really, really bad infection on my finger, and it literally, I got a splinter underneath and it swelled, and I had to puncture it. This thing looked absolutely mangled. And now my finger, you look at it and it's almost like brand new again. But adequate nutrients, I used the cocoa butter on there, did some other things on there for scarring, making sure my C levels are good. You would never know that this whole finger was mangled 4 weeks ago. Healed tremendously because we had adequate amounts of nutrients. Water, exercise, all these topical applications. And if you need a copy of these, you can come into the vitamin and herb stores in Lompoc, Bealton, Orchid, and Napomo, and we can always share a copy, show you products that will be helpful for this. And then, of course, with the show, you can always write things for, downline. Remember, too, we're also on youtube.com/Vhfilm, so you can rewatch the show again if you miss it on Comcast. Next, we're going to be moving on to the fitness portion of our show. Thank you very much. Fitness portion of our show, and today we're going to talk a little bit about gym etiquette versus an exercise. You know, as a woman, I go into the gyms and I lift with the big boys because I lift pretty heavy weights, and there's certain things that become a little bit bothersome when you're in the gym, and I know my husband's experienced this as well in the gyms, and so has my sons, have my sons. So I thought I'd bring up a few things regarding gym etiquette that maybe people are not aware of how to properly deal with equipment and other individuals in the gym. Number one, other people are not your mother. Put away your weights after each use. You know, I've walked up, and even though I leg press 500-600 pounds, I walked up and there's 8 45s on each side, and the big old bulky guy walks away and leaves the weights all over. And here I am, 135 pounds, and I'm yanking off these weights, clinging up after the guy who got too lazy to clean up his weights. Put your weights away when you're done with them. That's a very, very important thing. It's called courtesy. 2, don't hog machines. Let others work in with you. Whenever you're on a machine and you're doing a circuit training, for example, other people have a right to that machine as well as soon as you're done with it. So do your set. If you're moving on to the next machine, you don't sit there and say, hey, wait, I'll be on there a minute in the next minute or so. No, you've got to learn in gym etiquette. We share. There's only so many limited amount of machines, and we work in with each other. It's, we live in the United States. We kind of know how to play well with each other. So don't hog the machines, share them out. If you come in a sweaty mess or you're working out, please spray a towel and wipe your machines down. Walking into or sitting down on a sweat muggy someone else's sweat, yuck, gross. Guaranteed you're going to get a double look from any other girl in the gym that's going to see all that sweat that you left behind when she's got to sit on that machine. Number 4, please do not wear your colognes to cover up your odor, your perfumes, because think it's a wonderful place. Do not wear perfumes, colognes, sprays, body sprays, heavy perfume deodorants in the gym. It actually can cause physical harm to people because the chemicals, even though you may not realize it, that are released from those during sweat are actually harmful to the people around you, and they're actually nauseating. So please, none of that. Do not go to the gym dirty after work. I have seen construction workers, field workers, come in and haven't even washed their hands, and they're on this dirty, muddy, all over the equipment, and then I'm sitting down there ready to work out, and I'll be doggone, here I am on a filthy, dirty machine that's full of sweat. Please come in, wash your hands, change your clothes before you come to the gym. Come in a neat fashion and be courteous of other people. When you're working out, and I've experienced this as a professional trainer, when somebody's lifting weights in front of a mirror or during the workout, walking in front of them, standing there in front, or sitting there staring and gawking, especially as a woman, that's not considered good gym etiquette. Please, let a person finish their set, then go ahead and absolutely, walk in front and do what you need to do. But you can walk around and avoid people while they're in focus and concentration. These are just a few tips. Oftentimes, I think, especially young people, don't realize that these are all things that oftentimes experienced gym goers follow. So please, courteous, little bit of gym etiquette is appreciated. Thank you very much. Next, we're going to be moving on to the research portion of our show. Welcome to the research portion of our show, and with us today is Ralph Turchiano.
And thank you for that intro. Now, we are heading into cold and flu season, the first article might spike a little bit of interest, titled, says the most commonly prescribed treatment for colds and sore throats offers no benefit and may actually make the illness worse. This study, coming out in this week's issue of the British Medical Journal, this week being 18th of November 2013, what they did at the University of Southampton is they showed that compared with paracetamol, ibuprofen, or a combination of both ibuprofen and paracetamol, just in case you can't take enough medicine, provided no advantage for patients overall with respiratory tract infections. Respiratory tract infections being colds and sore throats. They also did a little bit of steam inhalation on the study too as a comparison, which also yielded no benefit. The research also showed that patients were more likely to come back within a month with worsening symptoms or new symptoms if they were prescribed ibuprofen or paracetamol. It says between 50 and 70% of the participants within 30 days actually had to come back. Which, to think about it, it's not even a really good placebo effect after all. I mean, if you're taking a medication, it's not only not doing anything, you're not even getting the placebo effect, it's got to be doing some massive harm to the individuals taking it. They speculate. Professor Little admitted that it was a surprising result and suggested that treatment may contribute to the progression of the illness. I'll repeat that. He said that treatment may lead to the progression of the illness. Why, you may ask? Says he adds this may have something to do with the fact that ibuprofen is an anti-inflammatory. It is possible the drug is interfering with an important part of the immune response and leads to prolonged symptoms, meaning you're sicker longer, or the progression of symptoms in some individuals, meaning you begin to feel much sicker after a while taking those medications. The randomized controlled study looked at 899 patients who were presented at their GP respiratory tract infections because they received different treatments, the paracetamol and ibuprofen, or a combination of both. Participants were then told either to take it as needed or regular intervals at 4 times per day. So pretty interesting. The most commonly prescribed medication that most people believe you need actually does nothing, or even worse, makes things much, much worse. All right, on to the next. And this came out of the American College of Allergy, Asthma, and Immunology, otherwise known as the ACAAI Annual Scientific Meeting, again being the 18th November of 2013. It is a study, or I should say a report, titled Allergic to Gummy Bears? Be cautious getting the flu shot. Why, they may ask? Well, it's the gelatin allergy. Now, gelatin is supposedly not a common allergy, but if it's a concern and you are determined to get a flu shot and you're not certain, may not be a bad idea to go to your allergist and get tested. What they discovered, and this is why. Gelatin is used in the flu shot as well as other vaccines as a stabilizer. Because it is found in the vaccine, those with a known allergy to gelatin can experience allergic reactions such as hives, sneezing, and difficulty breathing. Also, too, as far as that, life-threatening as far as anaphylactic. These gelatin reactions cause the hives, swelling, itchiness, shortness of breath, and the anaphylactics itself. So a lot of people think they're reacting to the vaccine. Well, they are, but not necessarily the part that they think they are. Because of this, precautions should be taken, such as having a board-certified allergist administer the vaccine in a person with a known gelatin allergy in case a reaction occurs. Well, there you're going to have to weigh out the risk to benefit. Getting sick for a little while, or anaphylactics, and doing this every single year, and that's only the flu shot, not combined with other flu shots. The gelatin is usually derived from cow, pig, or fish. Kind of an issue or dilemma for those which may be Muslim or Jewish, looking for a kosher vaccine. Gelatin can be found in a variety of foods and pharmaceuticals, including gummy vitamins, marshmallows, and candy. So, if a concern in regards to the flu shot, and these are the reactions you tend to get, and you are allergic or have reactions to marshmallows or gelatin-type foods, definitely get tested and see if that risk is worth the benefit to you. And talking about allergies. In another article titled Oral Allergy Syndrome and High Blood Pressure Medications Can Create a Lethal Cocktail. Oral allergy syndrome. Again, another article coming out of the American College of Allergy, Asthma, and Immunology, the ACAAI. Again, what they discovered is this. Oral allergy syndrome, i.e. hay fever, with certain types of unique aspects, sufferers that take high blood pressure medication may experience extreme facial swelling and difficulty breathing the next time they bite into an apple. When patients with oral allergy syndrome, i.e. hay fever, take an angiotensin-converting enzyme ACE inhibitor or hypertension for hypertension and congestive heart failure, they are increased risk of life-threatening allergic reactions known as anaphylactics, according to the new research. It says this study was obviously produced by the American College of Allergy, Asthma, and Immunology. And symptoms can include extreme facial swelling, angioedema, and difficulty breathing, which can lead to death in some cases. Again, your risk to benefit ratios. Hay fever sufferers that experience an itchy mouth, these are the special caveats, itchy mouth or scratchy throat after eating certain raw fruits or vegetables and some tree nuts may have what's called oral allergy syndrome. It is also known as pollen food syndrome, since it's caused by cross-reacting allergens found in both pollen and raw produce. Sufferers can often mistake oral allergy syndrome as a food allergy, but it is not a food allergy. And often patients can eat that food when it is cooked. For example, an individual may have a reaction to raw apple, but not to apples baked in a pie. It says when allergists advise patients to avoid raw produce and switch from ACE inhibitors to androstatin 2 receptors, ARBs, therapy, no further oral allergy symptoms occurred. And what are we talking being reactive to or running a risk of to pollen food allergies? I'm going to run through it real fast. Birch pollen, apple, carrot, celery, cherry, hazelnut, kiwi, peach, pear, plum, kind of like tongue twister. Grass pollens, celery, melons, oranges, peaches, tomatoes. Ragweed pollen, banana, cucumber, melons, sunflower seeds, and zucchini. If you react to any of those and you get that itchy mouth syndrome and you're about to go on a blood pressure medication, an ACE inhibitor, think about it. See if your doctor possibly can move you to a different type of blood pressure control medication. Otherwise, it can be a life-threatening reaction. And since we keep on going, let's go to statins. Well, the new U.S. guidelines to statins, we're going to talk about real fast, means if you're above the age of 40 and you have a 7.5% risk of a heart condition over a 10-year period of time, you qualify for cholesterol-lowering medication. Now, that put the British up in alarm, the British medical community, because they don't see any benefit at 7.5%. So meaning if you're in the United States like we are, you go to a doctor and you're 40 years old older, there's a 92.5% chance that you are going to be prescribed a statin, regardless of your cholesterol. I have no clue how they make the determination, a 7.5% chance of a heart attack over 10 years. That's playing the numbers pretty close to the gambit. They said also too, and this is Dr. Malhotra, I think this was very possible it will also happen in Britain, because what happens in the United States happens here. It says one thing we have learned in the past decade is the considerable influence of very financially powerful pharmaceutical industry over prescribing and modern medicine. The trends suggest this influence will have some same effect over the UK. The reason they're concerned about this is because it creates far more harm than it does good. And the doctors in Britain believe also one thing too, that this will only benefit the pharmaceutical industry financially, and that is it. My time is up, and thank you very much for listening.
Thank you very much, Ralph. Once again, do your research, and if you'd like, obviously we're on Comcast, channel 25, but if you would like to watch the show again, youtube.com/Vhfilm. Thank you again for joining our show.